So welcome again to the next part of our presentation, where we will be displaying a lot of case studies, and we will also discuss in detail how the dosing happens for different ailments and how remission is achieved. There are cases where it takes much shorter duration for the results to come by, and there are cases where it takes much longer duration, and the doses of vitamin D are also vast and variable. So here is what we start off with. Now this is a case of psoriasis. The person that you see in the image is one of my mentors, Dr. Renu Mahatani. She's based out of Pune, and ma'am was one of the pioneers for the Coimbra protocols in India, especially for psoriasis and other autoimmune conditions. Now this is her own story, where if you look at the images of before and after, how she battled her own journey and found the Coimbra protocols and walked that journey and is completely healed and in remission. So again, this is a before and after of the psoriatic patches, the before and after. But now again, before and after the treatment, just with vitamin D as a therapy, and also obviously the cofactors, again before and after. So these are case studies. 6 cases of psoriasis were treated daily with oral vitamin D, dosages ranging from 30,000 IU to 60,000 IU over a period of 2 to 8 months, followed by a much lower daily maintenance dose. The doses are adjusted on the base levels of the PTH hormone or parathyroid hormone. It is a clinically monitored line of treatment, so it's not something which is random casual supplementation. For all of our patients, we monitor their blood values, like their vitamin D, their lipid profile, their liver function, their kidney function, their PTH levels, their ionized calcium and the serum calcium levels, practically every 45 days to 2 months or 3 months, depending on the severity of the case and depending what we are doing in the line of treatment. These are studies which were published, and the outcome of it was significant control of psoriasis was observed within a span of 2 to 8 months, which was measured by psoriasis area and severity index, or it's called the PASI score, and a symptom visual analog scale. This is a before and after treatment. Now I will walk you through the journey of the patient, okay, where when the patient was inducted in for this line of treatment, their D3 levels and the PTH levels were measured, their ionized calcium levels were measured, and then we decide on how the dosages are going to be. So when the treatment began, her D3 levels were at 11 and PTH was at 65. Ionized calcium was at 4.26, and yet we decided to start with a loading dose of 6 lakh IU, which was a hammer or a loading or an injectionable dose to start off with, and then 30,000 IU of vitamin D on a daily basis ongoing. As a part 2, which was approximately 2 months later, her D3 was not measured, but PTH levels we have, which was at 37.5, and the ionized calcium was at 1.28, which is within the range. Vitamin D3 dosages were reduced to 25,000 IU because there was 70% improvement overall. Progressing further, which was 6 months down the line, her PTH was down to 13.3 and ionized calcium had reached only at 1.26. So which meant that we can still keep going, but on a further reduced dose, because remission was being achieved, progress was being seen. So the dosages were reduced to 20,000 IU per day, and the patient was seeing as high as 90% recovery or remission of their disease. 1 year down the line, when the blood work was done again, the PTH was still at 18.8, which is well within the reach. Ionized calcium was still at 1.22, and so we kept the patient at that 20,000 IU per day, which was approximately 60,000 IU twice a week was more than sufficient, and the patient is in remission. This is the next case. Again, you can see the baseline and after treatment, and similar to the previous one, we started off when the D3 levels were at 21.3, the PTH was at 113, and ionized calcium was at 1.27. A simple 30,000 IU per day was started off with, and 2 months down the line, there was 70 to 80% improvement The D3 levels, if you see, had reached 150. But the PTH was still at 83.3, such that we can still keep going further and further. The ionized calcium was reached at 1.33, but the vitamin D dosages, because there was improvement, we reduced the dosages down to 15,000 IU per day. The D3 levels reached above 150. The PTH reached at 58.6, which is still very well within the lab range. Now, there is no right or wrong with the PTH levels, because the PTH range is from 15 to 85. There is no right or wrong. When I say there is no right or wrong, it means that when we increase the vitamin D3 levels, the PTH keeps going lower and lower. But with higher the dosages, if the PTH is not coming down drastically, that tells us about the resistance to vitamin D. So over here, PTH being at 58.6, which is well within the reach. Ionized calcium is still at 1.06, but we could reduce the dosages to 10,000 IU because almost 99% improvement was seen, and the patient is in remission for the last 2.5 years. Again, another case study where if you look at the images at baseline and then after treatment, in this patient, when it was started off, the D3 levels were at 9.44 and the PTH was at 52. Ionized calcium at 1.1. So we started off with a 6 lakh IU injectionable and then 30,000 daily. 2 months later, the D3 levels have not been recorded, but PTH was at 35. And so we increased the dosages over here because there was no improvement. And when D3 levels were brought up to 45,000 IU per day, is exactly after 8 months, it was observed that there was 60 to 70% improvement. And the PTH was still only at 29. So we tweaked the dosages from 40 to 30,000 IU and then from 30,000 to 20,000 IU over time. And over 1 year or 2 years, 99% remission was achieved. PTH was still at 34. Ionized calcium is still at 1.22. And D3 dosages were kept at 20,000 ongoing basis daily, which tells us that even higher doses of D3 are actually not toxic. What one has to be careful about is the calcium, and that is constantly monitored. So in this case, if you can see, there is a disc bulge which is marked in the circle, and this is a before and after screening of the dorsal spine, and the post image, which is the after image, is suggestive that it was resolved, and it is suggestive of absolute resolution of the case. Now, for you to understand that there is no fixed dosage for a particular disease. So it's not, we get a lot of calls from other colleagues at times or other doctors, or we also get calls from patients who want to try this line of treatment on their own because they've read about it from somewhere, or they've seen videos of international doctors suggestive of the Coimbra protocols or the vitamin D as a therapy, and they just simply ask us what should be my dosage. And please understand that this is a very thoroughly monitored, feedback based protocol where we have to go step by step, where we have to work with the patient, and the patients have to constantly be in touch with us and to keep providing us that feedback so that we can keep tweaking not only the D3 dosages but also the cofactors, which are very, very relevant in managing the entire protocol. So there is no fixed dosage for a particular disease. Doses varies based on the degree of vitamin D resistance. It also depends on the degree of autoimmunity and number of organs involved. So there are a lot of patients who also have underlying other chronic ailments, like let's say type 2 diabetes or hypothyroidism or osteoporosis, and so many other factors including aging, where the resistance to D or the degree of, a lot of patients also come with multiple autoimmune disorders. So we see this quite often where the patients have Hashimoto's thyroiditis and lupus and psoriasis, muscle wasting type of autoimmune diseases, suffering all of them together, in which case the dosages varies person to person. They are weight dependent, they are dependent on the degree of resistance, they are dependent on how careful we have to go because of other organ involvements. Another case study, just for you to understand, before and after, where 30,000 to 50,000, how the progression went, where we started off with 30,000 IU and then eventually taper it down to 15,000 IU, and then just to 60,000 once a week, which is generally how it is recommended even conventionally. This particular case was achieved only with 60,000 once a week, And you can see the before and the after, a simple case study of joint psoriasis, or basically such cases when left unresolved do progress into psoriatic arthritis. Okay, in this case, when we started off, the D3 levels were at 15.1 and the PTH was at 83. And we started off again with a dose of 30,000 IU and then progressed further over time to 50,000 IU, and 60,000 IU was kept for 6 months under monitoring, and then brought it down to 50,000 IU and then eventually to 40,000 IU when the D3 levels reached 135. And if you look at the PTH, it was still at 78, which means that we had actually much more higher scope. The disease would not have gone into remission. But fortunately, at 40,000 IU, in a span of year and a half, remission was achieved. So, as I mentioned, that a lot of factors are dependent on the success of the entire line of treatment. Now, cellular death or damage has lesser chances of reversing. However, the process of autoimmune can be kept under control. The disease progression can be kept in check. Now, why are we doing this? Because using immunosuppressants or biologics is not the real solution in the long run, but keeping it in check and balance just with a natural immunomodulation therapy, just using vitamin D and the cofactors, is actually where you are not only keeping the patient healthier and you are helping reverse the disease substantially, or at least keep it in the remission stage or allow it not to progress further. So the more the duration of cellular death damage, less the chances of reversal. Other conditions can benefit. Now in this particular case, if you observe, if you look at the SGPT and the SGOT, and if you look at the before and the after, look how beautifully the body has corrected itself. Although it is still a little out of the lab ranges, but from 2030 to 64 was the SGOT level, and 1784 to 43. Now this was the amount of inflammation in the liver. Obviously these are inflammatory markers, and you look at how beautifully vitamin D as a therapy with its cofactors can bring down the organs also involved in as inflammations. Now certain autoimmune diseases need longer duration to show the results, in which case people have to be patient. A lot of patients, when they come to us, people are desperate for help at times, and they want a sort of assurance that how long will it take and will I be healed or not. No one can really say that. You have to understand that it is a subjective matter where we have to go step by step. We have to follow a part of a system and a protocol, and at times certain disorders will take much longer to show results, but you have to stay with it. This is a before and a after, where when this started, the D3 levels were at 4.10 and the PTH was at 116. So again, we could start off with a 6 lakh IU injectionable and then progress with a 30,000 IU daily ongoing basis, and it took almost 2 years for the D3 levels to reach 100. Although we did taper off, but even at 20,000 or 15,000 IU ongoing basis, it took the body and this person 2 years to reach D3 levels of above 100, and the PTH did reach 10.8, but please understand the body corrects itself and we immediately taper off, or we give a washout phase of 3 to 4 weeks, and then again probably at times restart the line of treatment or just a maintenance protocol. More the number of autoimmune disorders, longer the duration to show the results. Like I mentioned previously, this patient has psoriasis, lupus, Sjogren's syndrome, Hashimoto's thyroiditis, multiple autoimmune diseases in a patient, in which case it does at times take longer time. There the resistance to D3 would be much higher. These are the general observations while treating thousands of patients over the last few years, where permanent remission is achieved for as high as 30 to 40%, provided that they keep the appropriate dose, person-specific dosages of the vitamin. Remaining get partial relief, which is as high as 50 to 70%, but control of the progression and reoccurrences are achieved, and the frequency and the intensity is reduced considerably. In this study, published paper, it is shown about the safety data in patients with autoimmune diseases during the treatment with high dosage of vitamin D3 according to the Coimbra protocol. So 319 patients over a span of 3.5 years received approximately 300 to 1000 IU of vitamin D per kg. In this study, it is suggestive that a patient of multiple sclerosis, 1000 IU per kg. So assume that the patient's body weight is around 75 kgs. 75,000 IU was supplemented to the patient for this duration, and it was observed that there is substantial safety data, or there is no toxicity even at higher levels of D3 utilization. So in summary, there is no fixed dosage for a particular disease. Doses vary based on the degree of vitamin D resistance and the degree of autoimmunity, or the number of organs involved. The more the duration of cellular death, damage, less chances of reversing. However, the process of autoimmunity can be kept in control and the disease progression can be kept in check. Some brands do not suit an individual. The base oil of vitamin D also matters. Now, these are observations that we have found very valuable over time, where initially when we started off practicing this modality, we would simply recommend D3 and we would see a vast variation of results in different patients, because people would go out and buy any available local brand, which is perfectly okay by us. We did not have any, we still do not have any real association with any brands whatsoever. But over time, we observed that the results mattered and they varied drastically, in which case we were able to identify the right products, the right potencies, the right quality of ingredients. And that is exactly what we started recommending to people, and we started seeing a much more linear growth curve for as high as 95% of our patients. As a part of the summary, do not hesitate in starting at least the physiological dosage, which is 10,000 to 20,000 daily, as it can bring about positive changes. Even for an autoimmune patient or a normal person, these 10,000 IU is the bare minimum that your body needs to thrive in its own self. So vitamin D is not optional supplement. It is a non-negotiable cellular necessity. It is your life health support system. Whenever the art of medicine is loved, there is also a love for humanity by Hippocrates.